Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Today, I would like to start by updating you on a call that I participated in with the Regional Municipality of Wood Buffalo and other community leaders today. The Minister of Health, other officials, and I met with Mayor Scott and other local leaders to discuss the state of local emergency and ways to help support them in reducing transmission. As you know, Fort McMurray's public and Catholic school boards have moved all students in kindergarten through grade 6 to online learning until May 10th. As a result, we are extending the limits on group sports and performance for children and youth that were in place for grades 7 to 12 to this younger age group as well. Effective immediately, all indoor extracurricular activities, including youth sport, recreation, and performance in Fort McMurray for children in the K to 6 age group must either pause or move outdoors until in-person learning resumes. Another part of our response is working with AHS to identify ways to reduce testing wait times and to speed up the contact tracing process. This includes a change to our close contact testing approach that I'll discuss in a moment. I also want to stress that if you live in the area and are eligible for vaccine, we are working to ensure you have access to the vaccine in a timely way. Please keep checking to see if new appointments have been added as we get new shipments of vaccine. For those 40 and over, there is still an opportunity to receive AstraZeneca vaccines through walk-in clinics. No appointment is required and doses are available. These vaccines save lives and protect your health and the health of those around you. I got my shot and recommend that you do too. We will work with local leaders to identify ways to help answer any questions that people have about the available vaccines and ensure that people understand the benefits. This is just the start. We will continue to work closely with local officials to provide the supports they need. However, I want to stress that the high spread we are seeing in this region is not the fault of any one group, and spread is not limited to any one area. There are other areas of the province that are seeing extremely high case rates as well, and we have an unprecedented risk of transmission across the province right now. This is a province-wide problem in the context of a national and global one. We all need to take this virus seriously to bend the curve, including getting a vaccine as soon as we are eligible. Turning to today's update. Over the last 24 hours, we have identified 1,539 new cases of COVID-19. We have completed about 13,700 tests, and our positivity rate currently stands at 11.4%. As cases rise, we must keep wait times for testing as low as possible. That is why, along with increasing staffing and clinic hours across the province, where demand is high, we will shift back to offering just one test for all close contacts when they have no symptoms. Starting today, close contacts will be offered testing as soon as they are identified. If they experience symptoms at any point after that first test, they can get tested again. Otherwise, they must remain in quarantine until 14 days have passed, and as of today are no longer requested to have a second test. If you have a second test booked and have no symptoms, you can cancel this appointment to free up capacity in the system and shorten wait times for others. If you have a second test booked and you have symptoms, please keep your booking. Testing remains a critical part of breaking the chain of transmission. We have identified 812 additional cases of variants of concern in the last 24 hours, with variants now representing about 63% of all active cases. For the previous week, the R value for the province was 1.04. This includes 1.1 in the Edmonton zone, 0.98 in the Calgary zone, and 1.05 for the rest of the province. It's good to see that growth rates have declined, especially the decline from 1.06 to 0.98 for Calgary, But our numbers are still very high, and it's important to underline that cases are still growing, especially in Edmonton. Simply put, we are still heading in the wrong direction. There are now active alerts or outbreaks in 712 schools, which represents 29% of schools in the province. We continue to see rising hospitalizations. There are now 635 people in hospital being treated for COVID-19, including 143 in the ICU. Sadly, 7 new deaths were reported to Alberta Health in the last 24 hours. My thoughts are with the family, friends, and colleagues of these individuals, and anyone who has lost someone they cared about due to any cause. These deaths due to COVID-19 represent the worst possible outcome of infection. And throughout the pandemic, it has been important that we ensure these numbers that we report represent those who died from COVID-19, not those who died of another cause but happened to have COVID-19. Our process includes, in our initial counts, we include deaths where COVID has been flagged as a possible cause, even if it remains unknown. In those cases, medical officials review the death certificate and files post-mortem to determine if the virus was indeed a contributing cause. Most often, these remain classified as a COVID death. However, sometimes the review identifies that there was a different cause of death. Because of this, I want to advise of an update being made today to the total number of deaths due to COVID-19. Our most recent review of past reported cases has found 14 previously reported deaths that were not deemed on file review to have COVID-19 as a contributing cause. As a result, they're being removed from the provincial total. The numbers posted today will reflect that reduction, meaning Alberta currently sits at 2,067 deaths related to COVID-19. I want to be clear that each one of these numbers, whether the death was from COVID-19 or any other cause, represents the loss of a person who leaves a hole in the lives of those who mourn them. The adjustment to the COVID-19 statistics is a part of our commitment to transparent communication, but in no way reduces the magnitude of the losses experienced by those who cared about these 14 people. There are now 20,721 active cases in Alberta. That is the second most number of active cases since this pandemic began. There is no one source or sector that is driving this spread that we're seeing. It would be simpler if there were just one cause. Instead, the virus is spreading through all of us and the many in-person get-togethers, meetups, and other interactions that we have with other people every day. That is why public health measures are in place for a wide range of sectors, and why we all must continue to limit in-person interactions as much as possible. We have now administered more than 1.46 million doses of vaccine in Alberta, including almost 30,000 in the last 24 hours. That means that around 26% of the people in the province have received at least one dose of this vaccine, and about 6% of our population is fully vaccinated. Every day, more people get immunized, and that's a good thing. However, as more people get their shot, I want to stress that getting the vaccine does not mean that the rules no longer apply. Whether you have 1 or 2 doses, you still need to be careful. No vaccine offers 100% protection. Getting your dose makes it less likely that you will experience severe illness, but it's possible that you could still carry the virus and be contagious to others, even after your immunization. Right now, with the vast majority of people still not immunized with even 1 dose, it is essential that anyone who has had the vaccine continue to follow all the public health restrictions in place, both to limit the chance that they become infected and spread to others, but also to be part of setting the tone for all of us to keep following measures that we still need right now. In the coming months, when more people have gotten protection, things will change. Right now, we just need to stop spread and lower our cases for a little while longer. I know that's something we've all heard before. After 14 months, it's hard to dig in one more time and to feel like sacrifices like avoiding indoor social gatherings still matter. But they do, and we are so close to getting through this. Each one of us matters, and our actions can mean the difference between life and death for those around us. Anything that we can do to limit in-person interactions with other people outside our household will help us bend the curve and move past this pandemic. Thank you, and I'm happy to take questions.
All right, we'll go to the queue now. We have a very full lineup, but we'll try and get through as many as possible. Operator, could you put through the first caller, please?
Thank you. The first caller is Jeff Slack, 660 News.
Hi there. Thanks for taking my question. Dr. Hinshaw, the Premier said yesterday that additional restrictions doesn't mean that more people will comply with the rules. Do you agree with his statement that if we did put in tighter measures, we wouldn't see much of a change in the numbers?
My observation has been that for rules to be effective, you need to have both rules in place and you need to have people following the rules. And we have worked very hard throughout the course of the pandemic to balance the restrictions in place and the impacts they have with the impacts of COVID-19. And of course, that it's important to continue to think through again the impacts that COVID-19 is having right now, as well as the potential impacts of restrictions as any decisions are made.
Jeff, is there a follow-up question?
Yeah, I just want to know if you had recommended yesterday in the Emergency Management Cabinet Committee that we should be looking at additional measures, given that we are nearing the peak. This third wave is nearing the peak of the second wave.
It's important to remember that recommendations that I make are a part of a Cabinet confidential framework. And I also want to reiterate that all recommendations I have made since the pandemic began have been received respectfully by elected officials.
Operator, could you put through the next caller, please?
Francois Joly, Radio Canada.
Oh, hi. Thank you for taking my question. I wanted to know, Dr. Hinshaw, we've had that last, round of new measures. I think that was exactly 3 weeks ago today. So is it time to go back and see, has this been effective? Because it doesn't seem to have slowed the growth that much when we see a positivity rate of more than 11%. So have they not been effective, those last measures?
What we've seen in the data over the last 3 weeks is a decline in the rate of growth. So with respect to seeing the impact of the combination of measures in place, it seems clear that the rate of growth is less steep. However, it's also important to note that the numbers are continuing to climb, while at a slower pace. That's obviously concerning with the very high number of new daily cases. And so again, it's critical. That's a reminder for all of us that the more that we can limit in-person interactions every single day with those outside our household, the more we can collectively move to not just slow the growth, but actually bend that curve down and decrease our cases.
Is there a follow-up question, Francois?
Yes. I wanted to know, we have 7 more deaths today. A lot of these people are in their 70s, their 80s. Do we know if any of them were vaccinated? What can you tell us about the impact of vaccination when we still see a lower number, but still people dying from the virus in age categories that have been widely vaccinated?
I don't have the specific numbers for these particular 7 people. What I can tell you is that we're working on an analysis of the cases that we've seen in people who have received vaccine. The vast majority of those who are infected after they've been vaccinated are infected within the 2 weeks after they've received their dose. And it's important to remember that it does take several weeks between getting the dose of vaccine and when our bodies have had time to build up the immunity that can help protect us from those exposures. And so, again, someone who gets COVID-19 from an exposure in that 2-week period, it's not because the vaccine didn't work, it's because that protection doesn't happen immediately. So that's the majority of cases that we've seen. There have been a very small number of people who have gotten COVID-19 and ended up, again, I don't have the specific number, we're working on that, but who have gone on to have a severe outcome. And we know that the vaccines are highly effective, but not 100% effective. And that underlines the point I made earlier, which is at this time, with very high case rates and very high transmission, it's critical that the vaccine is part of our overall response, but that we all continue following the public health measures until we can have enough people vaccinated that we can bring those numbers and that risk down.
Operator, could you put through the next caller, please?
James Keller, Globe and Mail.
Hi, Dr. Hinshaw. What's your understanding of the vaccine supply and the demand in Fort McMurray? This morning I checked, and the earliest appointment through AHS was May 11th, although a few dozen appointments have opened up later in the day. If people try to book and they're encountering a 2-week delay, does that indicate low demand in the region, or are they seeing the same supply constraints as elsewhere in the province?
So there's a combination of options in Fort McMurray, and I know that there is supply available of the AstraZeneca vaccine. So anyone who's 40 and over who wants to receive a vaccine can go to the walk-in clinic and receive a vaccine without even needing an appointment. So there is supply available of that particular option. With respect to Moderna and Pfizer, again, as you say, it's my understanding that the current supply is spoken for in the next short while. However, we are working to make sure that the incoming shipments that we will be receiving over the coming weeks, that we are ensuring that portions of that go to Fort McMurray so that those who are eligible are able to receive a vaccine as soon as possible. But as I said, there are many doses still left of AstraZeneca, so there is vaccine available, and that can be accessed with a low barrier way through the walk-in clinics that are currently happening in Fort McMurray.
James, is there a follow-up question?
Definitely. And so the leaders of 11 First Nations and Métis settlements are calling for several stricter measures, including a stay-at-home order, a curfew, closing of patios, restriction on businesses in the Wood Buffalo region. Is this something that you're considering, and do you think those measures are necessary given the high rate of infection in that region?
We know that the limitation of people, the fewer people who come in contact with other people outside their household, the less case transmission we're going to have. And so how we can most effectively make that happen, again, there are two things we're doing right now: ensuring that vaccine is made available to all those who are eligible, and of course then looking at what are those other options, whether it's Fort McMurray or other areas of the province. Is there anything more that's needed? But again, that is a decision that hasn't been made yet.
Operator, could you put through the next caller, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. The federal government says discussions are underway with Alberta for military help. AHS is directing inquiries on this to the province. So at what point would the province require aid from the military? What are the thresholds?
Unfortunately, the conversations about any potential aid from the military are not ones that I have any details on. So I think that's something we'll have to take away and get back to you on.
Julia, is there a follow-up?
Yes, thank you. Just to follow up on some questions that were asked prior, I recognize that you're not an elected official and you are not the decision maker, but personally, what would you like to see done to help stem the third wave, and does it include stricter measures?
There are a range of things that we need to do, and one of the things obviously that we need to do is to work with those across the province who are leaders in their own communities to be able to remind those who are feeling disheartened, who are feeling that they have lost hope that we can get through this, and that despair perhaps is driving those actions, saying that they don't consider the public health measures to be relevant anymore, or don't see that their individual actions make a difference. So we need to work with those who are influencers in their local communities to make sure that the message is loud and clear, that until we're able to provide that protection that vaccine offers to the majority of people in our province, COVID-19 remains a significant threat to our communities, to our healthcare system, and so no single person can carry that message. So one of the really key things that we're doing is, again, doing our best to make sure that we're working with partners to get out messages of the importance of vaccination, the importance of following public health measures. Whether or not there are other policy tools that need to be used, again, I remain concerned about the cases and the trends. And so the discussions about what the right policy tools are to be used is a very difficult decision that is a decision for elected officials.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
Kevin Nimick, CTV Calgary.
Hi, Dr. Hinshaw. Can you clarify what degree of immunity people who have tested positive for COVID-19 in the past have now?
There's some interesting research on this from around the world, and part of what has been demonstrated is that the immunity that someone who's been infected with COVID-19 would be expected to have depends in part on their age. So the older someone is, the less protective an infection is against future infections. So for people who are 65 and older, my memory of the data is that it's less than 50% protection. And so because of that, we strongly encourage anyone who has been infected with COVID-19, the vaccine actually will provide better protection than having been infected. And so even if someone has had COVID-19, it's important that they still receive vaccine when they're eligible, because that protection level, again, varies with age. The other thing that's important to note is that even younger people who may have a higher level of protection against the same strain, we know that there are some variants currently circulating in the province, such as the B1351 and the P1, that we know have a greater likelihood of reinfecting someone who's already had COVID-19, whereas the vaccines, again, depending again on the strain and the type of vaccine, are showing protection, particularly against severe outcomes, even with those variant strains. So it's difficult to give any single number, but the bottom line is that even if someone has had COVID-19, it's still important for them to be vaccinated for their own health and the protection of those around them.
Kevin, is there a follow-up question?
Yes, the Premier has said repeatedly that there is a natural immunity if you have tested positive, and he has used a combined number of both people being vaccinated and what he calls natural immunity to predict a threshold at which we could host summer events like the Calgary Stampede. Is having had COVID equivalent with getting vaccinated, and is that your advice that the Premier is speaking on?
I do believe it's important to factor in immunity post-infection to our planning, because again, we do know that there is some level of protection that is conferred. It is not equivalent to vaccine. However, again, it has been a part of my advice that we need to consider both of those things, because we know that public health measures and public health restrictions have significant impacts on people, and so we need to be considering the big picture when we're looking at summer planning. However, having said that, again, it's critical that while we're looking at that big picture for our planning at an individual level, people need to know that even if they've had COVID-19, it does not protect them in the same way as having had a vaccine.
Operator, could you put through our second last caller, please?
Bill Ford here, CTV.
Hi, Dr. Hinshaw. You mentioned following your meeting with Mayor Don Scott that you will ensure there is supply there for people who are eligible for the vaccine. But that's not exactly what they're calling for. They're calling on the prioritization of that region for vaccines, so everybody getting a vaccine who's an adult. So it's more like what's happening at the meatpacking plant. Is that under consideration? Is that something that you are considering recommending, or is that something that's totally off the table for the Fort McMurray region?
We are currently looking at our limited vaccine supply. We're looking at the situation not just in Fort McMurray, but in other parts of the province, which have high rates as well, and considering how we can best allocate within that limited supply to make the biggest difference. But it's really important to remember that while Fort McMurray has a very high rate that is concerning right now, it is not the only place in the province that has those high numbers, and whatever policy, if we do make a change, that it would need to apply not just to Fort McMurray, but that we would need to be looking at other areas that have similar challenges as well. And again, because we have such a limited supply and we still have not been able to offer vaccine to all those who have that high risk of severe outcomes, there are different challenges that we need to factor in as we consider those options.
Bill, is there a follow-up question?
Yeah, just a quick one. And to your answer, but Fort McMurray has the highest rate of infection right now in the province that has the highest rate of infection in Canada. So is it not worth, just looking? You've done it in meatpacking plants. So why not consider doing that in Fort McMurray as well, where the problem appears to be worse?
Oh, it's absolutely on the table. But as I said, while Fort McMurray is the highest right now, there are other places that are quite close to it. And so what we're looking at again is the possibility of whether or not we may have some additional supply that we could allocate. But it's important to remember that we have a limited supply. So anything that's allocated there, which is on the table for discussion, would be taking it away from somewhere else. And those are the very difficult decisions that we need to make about what would have the greatest impact.
Operator, could you put through our final caller, please?
Lisa Johnson, Edmonton Journal.
Hi, thanks for taking my question, Dr. Hinshaw. Last week, there was a 7-day average of new cases. I'm counting numbers between Monday and Monday of more than 1,500 per day. And AHS has told me that contact tracers are able to investigate about 2,000 cases per day. How would you characterize Alberta's contact tracing efforts at this point as case numbers continue to be quite high?
Our contact tracing team has been expanded since the late fall to be able to meet that target of 2,000 cases a day, where those 2,000 cases are contacted within 24 hours, and each of them receives an interview from that case investigator so that we're able to understand where they likely acquired disease and the list of their close contacts. And it's a credit to Alberta Health Services and the work of the team that has expanded their capacity that they are able to meet that target. And we continue to work very closely with AHS to be able to allocate, again, the resources of that contact tracing team to not only do that work, but also to be able to do some additional work investigating the variants of concern that are the lower volume variants right now, so P1 and B1351. And so again, I would just want to commend Alberta Health Services and their contact tracing team for their flexibility, for their hard work, and for expanding that capacity to be able to meet those targets.
Lisa, is there a follow-up question?
Yeah, thanks, Tom. So the reason I ask is that we've been hearing from some Albertans that there has been no contact within 24 hours from contact tracers, and in some cases, no communication at all with close contacts or severely delayed communication to the point where some people are only getting contacted after they're done isolating after they've tested positive. So I'm wondering if there's a communication breakdown due to the fact that AHS is relying at least to some degree on workplaces and schools notifying Albertans of their close contact, or is this just to be expected from the rise in daily case numbers and the caseload?
I can't comment on individual cases. It's not my understanding that that is happening on a regular basis. So I think without knowing those details, it's concerning if there are people who are not being contacted until their quarantine is over, because that's not, again, the infrastructure that's currently available is sufficient to be able to complete those case investigations and contact tracing. So if there are certain individuals who may not have had that experience, then I think those would be opportunities for quality improvement. And I would encourage anyone who's experienced that where they've gotten a positive test result and haven't been called by a case investigator within 24 to 48 hours. So I'd ask them, certainly that 48 hours is the outside limit of what we would expect. If they haven't received that call within 48 hours, then it would be recommended that they call 811 to make sure that there's follow-up that's happening, because again, that's not a part of the current process, and people should be receiving those calls within 48 hours. It does take then sometimes a little bit of time once the close contacts have been identified for those individuals to receive a call or text. However, again, it's my understanding that in the vast majority of cases that is happening quickly. So it is concerning to hear about these specific examples, and we can perhaps get more details if you have them, and then follow up to try to understand if there's a pattern.
Thank you all for joining us. Dr. Hinshaw will provide another update later this week. Have a safe evening.